Dr. Moataz Lecture 4, Immediate Loading, Key Concepts, Period of Undisturbed Healing, Follow Brainmark's Principles. After implant placement, cover it with the closure of the flap. No force should be exerted on the implant during the healing period. Healing period, mandible 6 weeks to 3 months, maxilla 4 months. Immediate loading process 1, implant placement. Crown can be placed immediately or within 4 to 5 days. 2, key points. Implant will be exposed to the oral cavity. Load must be evenly distributed to prevent healing issues. No force should be applied during initial healing. Healing and loading. Primary bone contact occurs at the time of implant placement. Secondary bone contact occurs post-healing, ranges from 30 to 70% depending on protocol. Goal: achieve 50% or more bone contact for successful immediate loading. Problems and considerations: healing of the bone. Drilling causes trauma to the cells, requiring time for healing. Immediate loading may not be optimal due to the trauma. Microgap issues. Repeated loading can cause trauma, leading to fibrous tissue instead of proper regeneration. Implant types and innovations. Non-submerged implants, one piece, visible in the oral cavity, require adequate primary stability. Technology advancements. Surface-treated implants increase surface area, allowing immediate loading. New implants can be loaded immediately, but are less used compared to older, smooth surface implants. Patient selection and criteria. Ideal candidates. 1. Good bone quality and quantity. 2. Proper implant selection and placement. 3. Follow prosthetic considerations. 4. Educated and compliant patients. Health considerations. Controlled diabetics, non-heavy smokers, and osteoporosis patients are better candidates. Bone quality, good bone quality, D1 or D2, is critical. Avoid posterior maxilla for immediate loading due to poor bone quality, D4. Measuring stability. Torque wrench measures primary stability. Desired torque is above 30 nets. Perio test measures implant mobility. Drawback: probe hitting can cause trauma. Ostel resonance frequency test measures implant stability quotient, ISQ. Higher ISQ above 60 indicates readiness for immediate loading. Implant placement and loading techniques. Avoid overexpanding bone, gentle drilling, proper irrigation, and maintaining a sharp drill. Expanders used to expand bone, but can cause issues if the bone is not suitable. Guidelines for placement. 1. Minimal trauma enhances healing. 2. Achieve excellent primary stability. Prosthetic considerations. Temporary restoration should be placed out of occlusion. Final restoration should be placed in centric occlusion. Occlusion: avoid any interference to ensure success. Full arch restoration with opposing denture is more stable. Instructions for the patient. 1. Avoid hard food and follow oral hygiene instructions. Fabrication methods for temporary crowns. 1. Use impressions taken before or during surgery. 2. Use CAD/CAM for designing and placing the restoration. Detailed steps for immediate loading. 1. Assessment. Evaluate patient's bone quality, quantity, and overall health. Ensure no contraindications like uncontrolled diabetes or heavy smoking. 2. Implant placement. Perform gentle drilling with proper irrigation to avoid overheating the bone. Place the implant and ensure primary stability using a torque wrench, 30 Nend. 3. Temporary restoration. Place a temporary crown or abutment out of occlusion. Use provisional cement to avoid dislodgement. 4. Monitoring. Use Ostel ISQ to monitor implant stability, 60 for immediate loading. Ensure there is no interference in occlusion. 5. Final restoration. After 4 to 5 days, or once healing is adequate, place the final crown in centric occlusion. Ensure passive fit of the restoration to distribute forces evenly. 6. Patient instructions. Educate the patient on avoiding hard food. Emphasize the importance of oral hygiene to prevent infection. 7. Follow-up. Regular checkups to monitor healing and stability. Address any issues promptly to ensure long-term success. This